let's focus more on coinsurance, or what we call the estimated patient portion. The benefit plans typically categorize what portion they pay into 4 separate categories: preventative, basic, major, and orthodontic. Preventative are procedures considered necessary to prevent costly dental problems. These are typically the procedures associated with your biannual hygiene visits. When going in-network, these are most often paid 100% by your benefits plan, the exception being on x-rays, which are not always paid for 100% depending on the plan. Out-of-network, most plans will consider their portion between 60 and 90%, leaving the patient responsible for paying between 10 to 40% of the fee. The benefit plans always pay higher on preventative procedures because the cost of treatment is lower. It is cheaper for the plan to pay 100% for a regular cleaning visit than to pay for major treatment. These procedures are always subject to limitations based on age and frequency, such as only 2 visits per year or only covered under the age of 12, for instance. For basic, the typical procedures included in this category are fillings, basic perio disease treatment or gum therapy, non-surgical extractions, adjustments and repairs to dentures. When going in-network, these procedures are usually paid between 45 to 80% by the benefits plan. Out-of-network, most plans will consider their portion between 40 to 60%, leaving the patient responsible for paying between 40 to 60% of the fee. This category is still less than major procedures, so the benefits payout percentage is still higher. These procedures are often subject to exclusions and alternate benefit clauses. We will cover this topic in a separate segment called Plan Limitations and Exclusions. The procedures included in the major category typically involve treatment where at least 50% of the tooth is compromised or the tooth is considered beyond repair. For example, this covers crowns, full and partial dentures, root canals, oral surgery, implants, and bridges. When going in-network, these procedures are usually paid between 35 to 65% by the benefits plan. Out-of-network, most plans will consider their portion between 20 to 40%, leaving the patient responsible for paying between 60 to 80% of the fee. These costs are high, and thus the benefits provider pays out less towards the cost of treatment. These procedures are frequently subject to exclusion and alternate benefit clauses. And finally, orthodontics or braces. This category covers procedures such as conventional braces, Invisalign, limited ortho or short-term treatment, and retainers. Regardless of in versus out of network, the benefit plans usually pay between 50 to 70%. These are always subject to a lifetime maximum. Lifetime in this sense, meaning the time you are in this particular plan, and are often subject to age restrictions and waiting periods.